just over the last 2 years, I've seen an immense amount of change. And a lot of people, again, are frustrated with their costs and they're asking the questions. I mean, you look at a factory, if a part hits the floor, they lose money. And they're tightening their belt on a lot of things. And I think 2026 is going to be an epic year of change. I really do.
Yep. Well, and I think we can, say that, self-funding isn't for everybody.
Yeah.
There are, groups that are starting to look to ICHRAs, for example. I don't want to go down that rabbit hole, but I wouldn't say ICHRA is a long-term solution either, because what's happening in the individual space.
Yeah.
Those plans are going up double digits, but it may be a Band-Aid for the employer for a couple years if they're dealing with claims intensity, but getting to that self-funded world where they can see the transparency and have that control over their plan. We spend 99% of our time educating employers on self-funding and how to do it a better way, because you can't just go self-funded. And I hear a lot of people on LinkedIn and other podcasts that self-funding isn't the destination, it's the beginning of the journey.
Yeah.
You don't just go self-funded and then say, okay, we made it.
Yeah.
Everything's going to be sunshine and rainbows.
Yeah.
No, you're continuing to dive into the data, tweak, find different vendors, find different partners, because the whole goal is to A, try and find vendors to lower the unit cost of care, or B, how can we completely remove, those claims to the plan and try and get your people healthy and all those things.
Well, yeah, right. Because at the end of the day, the underwriters have to show up to the calculator. And it might come down to just an analysis and say, yeah, you are in the best spot you need to be right now, or that where you're at. Yeah. And we've actually seen some groups that have gone back to full insured after being self-funded. So we're not saying this is the only way to go here. We're just saying, generally speaking, over time, you can't beat self-funding. It gives you the most control, the data, the proactivity, the ownership of the employees. It's a big package of information to, throw on the table of a company that's fully insured. But
yeah. So I think the takeaway really for employers is making sure that you are working with an advisor that understands stop loss.
Yeah.
But then secondarily, they need to be able to customize a vendor stack that's really going to meet your needs, but also just from a cost containment standpoint. We had Dr. John on here talking about direct primary care. That's a great resource. We had Amy talk about pharmacy benefit management and paying for medications for less, increasing adherence. There's so many different tools in our toolbox that we can deploy that can really put a lot of safeguards on your self-funded health plan, especially even if you're dealing with lasers and things of that nature.
Yeah. Well, and I think, teaser alert, we're kind of building these pillars out here. And so in an upcoming podcast, we're going to get people on the front line of healthcare about what they're doing from the specialty side and how they're taking control of this as well, because they're fed up like a lot of folks are, and they want to stay in business and take care of their patients. So again, that's as far as the teaser alert will go, but we've hit some really good pillars. Foundationally, it's DPC, right?
Yeah, and even to bring this full circle and how this is, connected to community connected health. I mean, our whole goal when we're meeting with employers is how can we build you a health plan that is not only going to meet your needs, but cost less. Yeah. Because our whole goal is to try and keep as many dollars within that organization's four walls and in your employees' paychecks and in their, bank accounts, and trying to get them to lowest cost, care avenues, whether that's lowest cost MRI, lowest cost medication, lowest cost this, that. Because again, we're just trying to keep as much dollars in the communities that we're working in as possible.
Everybody wins. I mean, I don't know what you can say negatively about our goal is to keep the dollars within your four walls, and it's a long-term solution. And we've had so many stories of people getting laid off, or they couldn't build a research and development facility or what have you. And I mean, it trails into everything. I mean, healthcare has got a residue on every single thing, whether you're buying a car or going to college. Why is student debt so high?
Yeah.
You could argue, payroll and benefits are driving. It's a pass-through. It's a tax to the students who are the customers, right?
Yeah. Well, I mean, I even saw something online that they took a picture of a receipt at the restaurant, and one of the line items was benefits, and I think it was, just wages and benefits or something like that. So, I mean, employers are feeling the hurt And if you really want to get pissed off,
Yeah.
health insurance is one of the biggest wealth transfers.
Yeah.
In my opinion, you're
Yeah.
paying these insurance carriers a lot of money. Like you said, it's
Mm-hmm.
more than your mortgage in some cases, all this money, and you're hoping and praying that they're working in your best interest.
Yeah.
Well, look at what your health insurance costs have done over the last 5 to 10 years, and look at the stock market and these big insurance carriers and how they've performed. I think they're doing just fine. House always wins.
House always wins. And yeah, I've had some laureates out there claim that this is one of the biggest national security issues that we have. And I think that the movement is happening in this country. I really, truly do. It's like the civil rights movement or voter rights. You can go back in history. You can Vietnam, whatever. I really, really feel that this is going to be a national social movement that people are jumping on. And I tell you, the best part is the doctors more than get it. The healthcare providers more than get it. We have a duty to salvage the greatest healthcare industry that we have, and health care for our patients.
I think there's enough people
it's a
now.
duty.
Not enough people now speaking out.
Yeah.
Whether it's people that work in healthcare saying, "Hey, this is enough," but
Yeah.
there's enough patients or everyday Americans that have been burned by the system, and they're saying enough is enough. We
Yeah.
just talked to someone at lunch that said, "I buy the highest deductible option. I'm healthy. I need something catastrophic, and I'm still paying almost $20,000 a year."
Yeah.
So I think the tides are turning. We've got people like Mark Cuban that are now very vocal on LinkedIn, Twitter. He's now started to jump into healthcare, not because he wants to make a bunch of money, that he's really trying to make change and disrupt this industry. And that's, we need more Mark Cubans out there speaking of these things, because you and I, we sometimes walk into a room to an employer that doesn't know us, no trust, and they just see us as a salesperson. And we got to break down those barriers and try and educate as much as possible and say, hey, we're not here to just sell you an insurance product. We're here to fix this for you.
Yeah.
Keep as many dollars in your four walls. And try and take care of your employees and their families along the way.
Yeah, and the most emotionally charged product that has ever been designed by mankind. We're not selling coffee cups or tangible items like you buy in a store. So it's a heaviness that I think the best part of what's happened over the last couple of years is actually having pharmacists and physicians at our table, and vice versa. They're inviting us to their table.
It's making a lot more fun.
It is making a lot more fun. It's
Because
about
you got the
time.
right people sitting at the table, and it's like nothing is more rewarding than sitting down with an employer and you got a doctor and a pharmacist sitting right there with you. And now you've got the whole system. And it's like, okay, how do we now cut out all the profiteering middlemen that are a disservice to your plan? And let's align ourselves with fiduciary vendors that are actually working on behalf of you, your business, and your people.
Yeah. Amen to all that. And I think it's also a reminder for the wonderful folks that decided to tune into these deals that this is not like the torn jeans of the 1990s or hair bands or the latest and greatest thing. This is beyond stickiness. It feels right because it is right.
Yeah.
And it's going to be all right.
Yeah.
And just,
There you
we're
go.
not telling you to work with
Another
us.
zinger.
So anyway.
Well,
great,
I think
great.
even, one of the other things that was top of mind too was, not all self-funded health plans are created equal. And I think we talked about that a little bit. And I was thinking about one of my clients that they were part of a much larger group that was self-funded. They had over 5,000 employees, self-funded, Cadillac plan. It was a school district. They've got some of the best benefits. And then they had to, the contract was getting changed, so they had to go out on their own independently.
Oh.
Well, now they're smaller, they're nimble, they're probably worried about benefits, but they have truly bought into all these strategies. They're doing DPC, they're doing direct contracts, they're doing RBP. They're paying almost half of what that school district is paying now.
Yeah.
So size isn't always, the catalyst that you need to have a bunch of employees or a large organization. It's the right strategy, 100%.
Yeah, we've got to work harder at getting consumers, employers out of the big bad wolf mentality, right? I'll huff and puff and blow your house down. And I can't speak for their experiences, whether they've been self-funded or they've gone to another carrier. This is just a radically different proposition. And we're really going to put the notice out there to the employees.